afternoon, everybody, and welcome to NPC 2021 and this discussion around connecting the dots for healthier life by putting data to work. India has a huge burden of disease. If you think about India, we have one-fifth of the world's population, the lowest cancer survival rate across the developing world, 3 million deaths due to heart failure, 49% of the world's diabetes burden, and a million newborn baby deaths in a year. So when you think about this, there is a lot that we need to do as a nation to really solve some of these tough problems. And data can really do a lot around it. So I'm really happy here to introduce my co-panelists with whom we will discuss about connecting the dots for healthier life by putting data to work. Please join me in inviting Anu Acharya, who is the CEO of Mapmygenome. She's a distinguished alumna from IIT Kharagpur, an entrepreneur who has been at the forefront of genomics for over 20 years. She's the co-founder and CEO of Mapmygenome, a company that pioneered the field of personalized preventive healthcare by making personal genomics tools available to the masses. She's also a recipient of the Young Global Leader Award from the World Economic Forum and the NASSCOM Executive Council member. Welcome, Anu.
Thank you.
We also have Mr. Sunil Raheja, who is the Chief Operating Officer of IKS Health. He holds a bachelor's degree in electronics engineering from the University of Mumbai, along with the General Management Program at UHT. He's an accomplished business operations and technology veteran with over 28 years of experience. As the Chief Operating Officer, Mr. Sunil Raheja is responsible for managing the customer operations at IKS Health across India and the US, along with leading the charter on building a scalable delivery model focused on driving standardization and automation across businesses. Welcome, Sunil. We also have Mr. Sumit Puri, who's the Chief Growth Officer at KEF Holdings. He's an alumni of IIM Bangalore. He's a global executive with over 27 years of successful track record in management consulting and leading IT and operations in top corporations. He has played technology leadership roles in the digital healthcare space at Evercare and Max Healthcare. And he also was he's currently the Chief Growth Officer at KEF Holdings. And myself, I'm Asha Poulose Johnson. I'm the VP of Data Analytics at GE Healthcare. And currently I'm responsible for the data and analytics strategy and execution for GE Healthcare globally. Additionally, I'm also part of the CDO forum, which is and represent India for the MIT CDO initiative. I'm really happy to be here and really talk to my fellow panelists on this important topic. So to kick us off, right, when we think about the end-to-end healthcare ecosystem and the data that is associated with it, it is very vast and very complex. On one hand, we have the pharma, clinical trial, gene therapy space, and the data that is associated with it. Then we have the healthcare provider ecosystem data, the hospital information systems, patient data, clinical history, insurance, and other financial aspects of it. Then we have medical manufacturers like my company, and who deal with equipment data and the analytics around optimizing clinician experience and efficiency. And finally, we now have a lot of data that is coming from wearables, smartphone apps, etc. So my question to all three panelists, and Anu, I'll start with you, is what is the role of data in your ecosystem and what have been some of the biggest advancements that you have seen in the recent times?
Thank you, Asha. So when it comes to genomics, I think data is kind of our base for doing anything and everything, pretty much. So a lot of the discoveries that we have come across in terms of the gene associations for different diseases, or whether it is in terms of whether a certain drug will work for you or not, or whether it's even in finding ancestry and things like that, everything ultimately depends on data, because that's what you are basing the whole correlations as well as causations for certain diseases and other things. So in many cases, the way I look at it, I think we are basically standing on what all the other giants in the world have done for us over the last hundreds of years. And what we are building on top of that is essentially a layer that will allow us to be able to extract insights from whatever has been done so far, but make it a lot more granular. But after you make it granular, I think the value of the data that in the genomics ecosystem works will be to be able to then connect it with the other dots. So very recently, I think there was an article that came out which said that we still don't know a very large portion of what goes on inside our cells. So I think what will ultimately happen is to be able to take the data that we get from genomics, microscopic, like the micro levels, as well as take it to a bigger level. So in some ways, I think if you can sort of zoom it like, a Google Earth in some form for the human body, I think that's what data will get us to at some point, very quickly, when we put these little pieces of data together.
Yeah, I mean, I think, see, the power of any data is in the connections and in the points where we can bring things together and then extrapolate it to make sense of a larger sense. So it's really great to see that, there are advancements that are happening where we can now not only tie genomic data with, microscopial and a lot of the laboratory and pathological kind of investigation data, and then also try to get it to a granular level. So Sunil, in your ecosystem, what's the data ecosystem, and what are some of the latest advancements in your space?
Sure. So I'll give you a slightly more business-centric, response, here as well, right? So what we do is really we help providers provide better, safer, and more efficient care to patients. And so what we really focus on is helping the provider, the doctor, and all the associated staff, that really takes care of the patient, to try to make that experience a little bit better. So obviously some of the traditional technology enablements were really the adoption of EHRs. Now, one thing you will find, when you speak to most doctors that have adopted EHRs, over the last 20 years, they will actually tell you that it started to take away the joy of providing healthcare, which is sort of oxymoronish, right? But it hurts, the technologists in us, that we were able to produce technology that really was intended to bring the ecosystem together, whether it was lab reports, EKGs, all the imagery, that is associated with good healthcare, as well as, recording clinical notes, clinical documentation, and everything else. But what it has done is, when you really zoom down and you do a study on how the interaction between a doctor and a patient, what you're finding in more and more advanced, nations where they've adopted EHRs, is patients walk away feeling like the doctor spent too much time on their systems, as opposed to spending time, with them, getting to know them. And they're starting to lose a little bit of that human touch. So what we've really got to do, and what's exciting, what we're trying to use technology and data, in recent times, is really try to get more and more voice recognition and leverage NLP and AI technologies and machine learning technologies to let the provider-patient interaction be pure. And instead of having them, to work on systems, to be able to create an ambient technology environment where you can capture this and you can actually do some of the tasks behind the scenes, whichever systems they are part of, and actually bring that together. That's one example. The other example that we are seeing, that is really coming out, and this will lead to a lot more opportunities as well, is the move towards really getting towards outcomes. Far too many times the doctor-patient interaction is the business is run based on fee for service, right? So you go see a doctor, you pay a fee for that service, and therefore a doctor is incented, perhaps to just make sure that they're treating you, but for every service they get a fee. Moving towards outcomes requires a complete change and a shift in the whole business model, right? That's what they call value-based care, where doctors need to start adopting more risk and actually get paid for the wellness of a patient versus a service to the patient. And that will then do a lot more to the ecosystem overall. And in here you can just imagine the places where data plays a big role, and analytics, big data analytics, risk management, risk analytics, predictive analytics, all of that comes into play. And those are some of the exciting things that are happening. It's still pretty new. We haven't really cracked it, because you've got to tie clinical outcomes with business outcomes and financial outcomes, looking at patient histories. So there's a fair amount of work still to be done there.
So that's actually very interesting, Sunil, and it's a little bit ties to what kind of work that I do, right? I mean, G Healthcare basically manufactures all these equipments like CTs and MRs and X-rays, and
That's right.
thing that we really see is, the initial focus was on digitizing the clinical workflows, right? And which is why probably you saw some of these challenges where, clinicians had to have massive IT capability and they need to use all these screens and buttons to get work done. I think the biggest focus I see in many of these equipment provider companies really to use the equipment data and then really enhance the clinical experience of the clinician with the clinician in the center so that they are spending more and more time with patients.
Got it.
All of these, levers and systems, it becomes so easy and intuitive for them. We actually see a lot of applications of data, big data, that getting into machine learning and eventually embedded AI at every step in the process, which also has use cases where you can, really help and assist the clinicians to make better decisions. So, I mean, it's absolutely true how the shift has happened from a focus on digitization to the focus on clinician experience. And coming over to you, Sumit, how does your data ecosystem look like, and what are some of the challenges that you have seen?
Sure. So I think, just to start with, I would say that, data is the new oil. It's absolutely, there's no question now. You look at it, the top 5 companies in the world, they're all data companies. Amazon, Google, all these guys, Microsoft, they all have really huge, insights that they've drawn out of leveraging the data correctly. So while data is the new oil, you also need to source it right and refine it, which we don't do sometimes. So I think we don't know the right sources. We don't know how to define it because we get a lot of dirty data also. As I think Sunil mentioned, and we kind of also had Anu touching about it. It's very important to understand, how do you really kind of get this data refined, because there's standards that you need to follow. When we talk about movement towards outcomes, it's very important that all the parts of the ecosystem work well together. Whether it is pharma companies, it is diagnostic companies or labs, it is the OEMs, like GE, it is, hospital providers, all of these guys. And the patient is at the center. Ultimately, we are looking at his record, which is so critical. And clinician is going to be extremely important stakeholder also, because, you have to make sure that the clinician is, comfortable using technology. Maybe 10 years down the line, you will find the clinicians who are already, very used to technology. They're digital natives. Today, they're not. They're digital immigrants, sometimes digital illiterates. So you have to get them to use technology. And I think that is where the challenge comes for us technology providers and operations teams and, all those hospitals that are there. How do we make it simple? How do we really make this whole ecosystem simple? And how do we connect the dots? How do we get all these partners to really kind of, come together in a very seamless manner, which will help us in the outcomes, which will help us in diagnosis? Frankly, I would really say our focus should be on prevention. We are not meeting 95% of the population's needs. It's only 5%. The genomics that Anu was mentioning, I think that is important. The DNA sequencing, understanding those aspects in the beginning, because I feel, and that's where the challenge comes. Today healthcare becomes sick care. People come to a hospital only because they don't know option. We have to make it healthcare in the true sense, wellness, as Sunil also mentioned, and that's where we will need to kind of look at a very different paradigm. Focus on prevention, look at personalization of medicine, at scale. Look at genomes, look at, some other, interventions like artificial intelligence, and start exploring how do we really make this experience much more easier for the clinicians, and then leverage this data very well to further improve and iterate and enhance your outcomes and enhance your procedures and diagnosis. So that's what I would probably.
Very well said, Sumit. So, Anu, coming on to you, right? I mean, in the whole genomic space, right? What are some of the things that you need to happen just within the industry or the governments to really start accelerating on some of these aspects? And, like, for example, the government of India recently has a lot of focus on the digital health mission. One of the focus areas being the digitization and democratization of medical records. So does that kind of things, and do these kind of things offer new opportunities for startups to come? NASSCOM supports a lot of the startup ecosystem. So what do you see there?
So I think, I've been in the genomic space for about 20 years now. And I would say that, one of the prime reasons for me to even start Mapmygenome was the fact that I think when the world is moving towards precision medicine, we didn't have the data for the Indian genome. And I think that was one of the key reasons. I think Sumit mentioned that some data is not refined. And in many cases, I think you might use a lot of algorithm, but if you didn't have the base level data for a specific population, I think a lot of the work that you'll be doing will pretty much be of waste. So one was that 7 years ago when we launched this, I think we had to clearly do a lot of the early, creating the data, creating that whole algorithm around it to be able to get to the stage that we are in today. So certainly, I think that the fact that the government has created the National Health Mission and also has a focus on creating the genome project and all of that, I think all add up, because I think they are very, very important. When you look at just the overall data that is available in the world today, I think just a few years ago, it was 86, 88% Caucasian, which basically means that a very large portion of the world is underserved, right? And I think that's true in most of medicine, because I think ultimately everything is based on data, and whoever has access to the data is ultimately deciding the rules and regulations around it. So it was created like that in regular medicine. The same thing started to happen in genomics, and we said genomics is very personalized. It is where if you can't just say that just because there's a mutation in the Caucasian population will be the same in the Indian population, and vice versa in the because it's in the Indian, it's not. So while there's a large part of the data that still remains the same, I think it's very, very important to be able to get to that sort of data. So I think I'd certainly applaud the government to be able to put in some of these programs together, because one of the key parameters in terms of how do we actually put all these data points together, whether it is putting the pathology data and the biochemistry data and the genomic data and other pieces of data together. I think one of the biggest challenges that anybody has is the continuity of that data, because you would never be able to find that longitudinal data easily. And I think that's a huge effort. That is, if people start actually using it. So if every hospital starts using it, if every diagnostic center, if every genomics company starts contributing to that data, I think we will have a rich source of data at the end of the day. But that ultimately depends on, will we still be as callous in terms of how we enter data? Because we saw that either we enter too much data, or we enter too less data. In the case of COVID, I think was a great first example where we really had to enter a lot of data, but I think we learned a lot in that process. In what does data across 1.2 billion people mean, and can we use that data to be able to make it simple, efficient, and be able to create a way that will allow people to feel like they want to enter that data, whether it is clinicians, whether it's consumers, whether it is nurses or anybody else. And I think once they start seeing the value, I think we will start seeing a ripple effect and getting to that. And certainly startups will be hugely benefited out of this, because for a lot of startups, getting access to that data is a very, very difficult task. I think they can certainly go to hospitals and others, but even hospitals might not necessarily have the data. But I'm sure, I think you'll get that answer from Sumit and from Sunil as well.
Yeah, I mean, Anu, I think that's very exciting. And as just to follow quickly up on that, right, as a very successful startup and having come through that whole data journey, because you just mentioned everything that you guys do is fundamentally based on data. What kind of thoughts or advice would you give to startups who are trying to start up in this whole new space, because there's definitely a lot of opportunity that's going to come up with the National Health Mission?
So one, I think that they should solve a problem that they truly believe in, because healthcare is not easy. And even with the health mission and everything else, you will get some amount of data, but there's also a large amount of regulation. I think I forgot to mention that, especially when you look at genomics and you look at anything that identifies, I think you have to be very careful in terms of how you tread that whole path of all of that. So I think believe in what you're doing and solve that problem that you care to truly solve. Second is to make sure that you understand that healthcare is not like creating an e-commerce shopping app. It is you are impacting people's lives. So you have to be very, very careful about how you tread on that path, because one of your wrong choices might make many people suffer. So I think those are the kind of thing that, data is great, but data has to be clean, data has to be used, and has to be enough volumes for us to start making predictions that people can ultimately. I'll give an example. For instance, one of the things that we do in Genome Patri, which is our product, is to sort of help people understand what their risks are for a certain disease or a certain nutrition and various other things. Now, if we didn't follow that up with a counseling session where we help people understand what does this probability mean, I think it becomes a challenging task, right? And I think that's the problem that the world faced. So you can you get started off from a technical point of view, but I think in the end, there is a human element that is there in healthcare always, because we have to remember that not everybody is as educated as, maybe the people listening to us over here. There are, and also I think that, we have to get it down to the language that they can understand. And I think that's a big challenge, because doctors were not trained in a lot of the new technologies that we are currently talking about. Consumers were not trained. There are lots of illiterate people. So how do we make sure that anything that we do in healthcare will ultimately impact people's lives in a way that, in a language that they can understand? And I think that comes upon us as people in the healthcare space to be able to deliver that to the average consumer.
Yeah, no, absolutely agree. And actually, the one thing that which I was curious, and Sunil, I'll ask you this question, right? One of the things that I've observed as the reason for the slowness in the digitization of the healthcare industry is the enormous complexity. Anu talked about regulations and things like that, which probably don't exist in the e-commerce world. And this needs to be dealt with as compared to the financial returns and the ROI. So, what are some of the things that need to come together or are already coming together to make investments or digitization and this whole thing that we talked about, and the whole discussion I started with the challenges we have in India, it becoming more attractive, because at the end of the day, it has to have a financial model too, right?
Yeah, you're right. And so, when you really look at, so look at it from two different lenses, right? When you started off, you sort of talked about who are all the different parties. You have the patient, you have the provider, you have the lab diagnostics, you have insurance companies, and you have the hospitals and so on. The other way to look at this, is the other triangle, right? Which is access, affordability, and quality. And when you look at that triangle and, with patient experience at the center, if you actually start addressing, each one of those, then you'll start hitting everything in the ecosystem that gets with it, right? So I think with COVID, what we saw, for example, accessibility became a challenge, and that led to, at least in the Western nations, a huge influx of telemedicine, and that became mainstream. It became part of how insurance companies covered it as part of treatments in India, wherever that was possible. That started to get adopted. Supporting that ecosystem. So now that's a real need. So if you're really going to support accessibility, in India, the private sector is greatly fragmented, while the government sector accounts for a lot of the underserved, part of the country. So they are the biggest, budget holder, if you may. So if you are able to then target your solutions in those angles that make sense, economically to those, series of populations, right, or those entities, would be one way to sort of try to tackle the challenge. So from a government standpoint, as being the biggest player, if their success metrics are about providing good quality care to the underserved population, then access, is a big deal. Doing that, leveraging technologies around, telemedicine is a big deal. Quality of health is another, important angle. Again, if you're able to create, right now, once we got the EHRs, right, the whole digital health mission is just saying, let's get EHRs out there. This is a mammoth, task. I don't know how many people actually appreciate, when you read that in a newspaper, the amount of effort it takes. My experience of having, done this again in, one part of India, it took us 4 years, to get it across an entire state. And, there's so many things that get uncovered, as you sort of do that. To do that across the entire nation is very ambitious and very good, because I think the one thing that it will start getting us is interoperability, which is one of the bigger challenges anywhere in the world. Even today, if you look at, the United States, for example, interoperability is there in name, it's not really there in spirit. Many of the software providers don't actually comply to the maximum possible, which would really enable the entire ecosystem to work very well. But India can learn from that. And as we sort of implement interoperable standards, we must do this in a way that also enforces software vendors to be able to meet that standard in the spirit of, you know, where those are created as well. Which only when you collect a lot of data, and, you know, Anu articulated this beautifully, right? Only when you get data that is entered in the same way, the right way, that's what Sumit was saying earlier as well, can you then start making sense out of it, and then you have enough volumes you know, on it, that you can start impacting quality metrics. You can start doing population health solutions, you know, on that, right? And then lastly, affordability, right? So affordability, you know, is really key. There are several socio-private institutions in India that have actually cracked this, and they've figured out a pyramid model where the same healthcare provider provides high quality at a higher cost for people who can afford it, the same quality at a much lower cost for people who are underserved, by really leveraging lean techniques, leveraging telemedicine, making sure they've got small centers in the village that has telemedicine connectivity into a smaller town with a little bit more skills. And then you only have to come into the big city, to the big hospital, once you've reached a point where that can't be sort of solved by that ecosystem that is there. And we already have that. We've got good green shoots in India that just needs to be learned from, you know, and expanded. So if you look at it from those three angles, I think, you know, we've got a shot, and startups have plenty of places in there, you know, to sort of focus on as well.
Yeah, absolutely, Sunil. I think, you know, it looks like the whole healthcare data management is ripe with opportunities for whoever can crack it. That seems to be the biggest challenge in able to really, you know, kind of glean and structure and, you know, make sense of this data and then put it to use. So Sunil, we're kind of coming to the end of the session. You know, one of the things, you know, that's really happening a lot is Sumit. One of the things that's really happening a lot is the growing adoption of wearables and home healthcare. You know, and how does this change the data landscape? And, you know, what kind of things need to happen, or interoperability need to happen in the existing healthcare platform, so that you can really now start it not becoming a, you know, separate ecosystem on its own?
Look, there has to be a conscious thought, you know, in every hospital or provider, in terms of what their data strategy is going to be. I think not very many people have thought about this carefully, because it's important to get that right. I mean, if I was to just go back in time, in Max Hospitals, we are the first digital hospital which introduced, you know, electronic healthcare in private hospitals. And it took us a long journey. I mean, Sunil was very, very right in saying it's a journey. It's quite an arduous journey. You have to be patient and, you know, make sure that this is, you know, kind of managed along with taking people along. I mean, I did this in e-prescription with doctors and Max Healthcare, you know, where we got them to do this in a very easy manner after almost 6 months of further improving the system to make it simpler, make it easier, you know, make it more accessible and, you know, and user-friendly. Now, the point we're really coming to is with IoT devices, with wearable devices, I think there's a lot of potential, but then they need to be clinical grade. They need to be accurate, you know, because many times just people try and do shortcuts. There is no shortcut to success. You have to look at quality. You have to make sure this is actually, you know, checked and confirmed. The actual testing is done rigorously, because the opportunity is huge. But if you get it wrong, as I think Anu also mentioned, you will probably have you know, patients' lives at stake. And the fact is, we should probably look at innovative models. You know, there are areas that could be looked at, you know, where we could probably have the patients, the customers, or their attendants entering this information into the system, or IoT devices entering this into the system. You know, when we look at AI, you know, kind of tools today, the doctor does not have time. You know, in India, if you look at Safdarjung or medical, or, you know, all of these big hospitals, government hospitals, etc., to ask a patient 20 questions to get to the real diagnosis. The patient can do it, his attendant can do it. And once you get that information, you have the AI engine and the algorithms and the Mapmygenomes working on it to give you some possible diagnosis. And that's where probably, you know, the doctor will be augmented. He will get that information to give him the right diagnosis. So there are opportunities. And I think opportunities for IoT device, kind of manufacturers, obviously opportunities for startups to create these, these clinical grade tools, connect with the hospitals. And I would say, please understand the problem. Don't try and solve the problem without understanding it. Get that problem understood. Talk to the hospital providers, talk to doctors, talk to some of those people who are facing these issues, consumers, and then work on your solution. So those things will be required, but there is huge potential, immense potential. That's all I can say.
Yeah, Sumit, definitely. I mean, I think the whole thing that you talked about, the accuracy of the devices or being clinical grade, I think is critically important. And I think a lot of times, if that's not the case, it can actually cause more harm than good. And, it can create a set of challenges of its own. I think we are coming to the end of the session, but I think I truly appreciate all of you taking time, and more so than spending time on this very important topic, which is very important for the human race, but it's a very complex problem. I mean, we just talked about a few aspects of it, and I'm sure we can spend hours trying to unravel the challenges and how we solve for it. But there is progress happening, talking to all of you and the things that you've been doing, definitely a lot of hope for the future. And I think in 10 years, from now, if we were having this panel, probably we will be talking about a different set of problems. So thank you so much for spending your time. And with that, we will wrap the session. Thank you, everybody.
Thank you.
Thank you.